educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our HealthyU webinar series. Today's topic is, what is healthy heart living? At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will always remain anonymous. Today's presenter is Dr. Gruberg. A native of Bolivia, Dr. Gruberg graduated from the School of Medicine at the University of San Simon. At 25 years old, he immigrated to Israel, where he worked for 20 years, completing a fellowship in internal medicine and cardiovascular diseases, working at hospitals and teaching at the Sackler School of Medicine of Tel Aviv University. During this time period, he took time off to do research as a Fogarty Fellow at the National Institutes of Health in Bethesda, Maryland, as part of the Human Genome Project. He later completed a fellowship in interventional cardiology at the Washington Hospital Center in Washington, D.C., where he later became the director of clinical pharmaceutical trials. All right, Dr. Gruberg, thank you again for your time. I'll pass it off to you to share the PowerPoint, and then we'll begin the presentation.
Okay, can you see my screen with the slides?
Yes, I can. If you could just go to the top corner to maximize it.
Is that good?
Yep, looks perfect.
All right, we'll get started. So thanks very much for attending this lecture. And like Jonathan said, at the end of the presentation, we can do it more interactive if there's any questions. I would like to start by talking about some of the most important disease we'd had in the last century and probably in our lifetime, which is, of course, COVID. Talking a little bit of COVID very briefly, just to put things into perspective. And this is the number of hospitalizations that we saw in the United States for this deadly disease. As you can see, this is by weeks, and we can see when it started, the disease. We can see the number of hospitalizations when we had our big peak at the beginning of 2022. And if we look at this second graph, this is the graph that reports the mortalities that we had for this disease, which was staggering. And looking at all the patients that died from COVID-19 during this 2-year pandemic, we can see that the number has surpassed more than 1 million deaths in such a very brief period of time, making it one of the most deadly pandemics that we will probably encounter in our lifetime. Why do we talk about this? Because we're going to be talking about cardiovascular diseases. Cardiovascular disease is the #1 cause of death in the United States and in the Western countries. It is by far the most serious disease that we can face, and it is in par with cancer, which is also a very prevalent disease. If we look at the this number two killers, we can see that the number of cancer mortality has increased over time. And while heart disease made a very higher increase in the 1970s, when smoking was still a good trend, we can see that we've managed to make a dent in the cardiovascular mortality by the year 2000, when we definitely developed better drugs and we were more aware of changes in lifestyle. But still, cardiovascular disease is the #1 killer in the United States. And putting things into perspective, we can see here in purple the variation through the years. We can see cardiovascular diseases. At the end of the year, we see a peak for almost always, because that's usually associated with winter. And we know in those cold months, there's a higher chances of having a heart attack and having a bad outcome. And you see the mortality for cancer, which is pretty straightforward in the blue line. And here at the right, you see that very high peak, where is COVID, that was such a deadly disease, but it was short-lived, but it had very dire consequences for people. If we look at the trends in males and females, for a long time, we presumed that cardiovascular disease was only affecting men, and we were kind of ignoring women. And we can see that in the 1980s, although we managed to send a message to men that they should have a better lifestyle, the mortality in women kept climbing because we were completely ignoring that until the year 2000, when we started to realize that actually mortality for women from cardiovascular diseases was actually worse. If we look at the present time, we can see that the mortality for male and female is the same right now. If we look at the mortality in the whole world, we can see that every year more than 18 million people die from cardiovascular diseases, which is 1 out of 3 people dying from cardiovascular disease, which is very important to understand. And here you have a graph that puts in perspective the mortality for cardiovascular diseases, cancer, respiratory diseases, and HIV. These are some of the high-risk factors for cardiovascular disease, such as high blood pressure, high cholesterol, obesity, physical inactivity, diet, diabetes, tobacco, kidney disease, and harmful alcohol. And we will be talking in more detail about the risk factors for heart disease, which is the topic of this presentation. Just to say something else about this, we know that in the United States, every 34 seconds, 1 person will die from cardiovascular disease. And about every 3 minutes, 1 person will die from a stroke, which is part of the cardiovascular diseases. 1 out of 4 persons in the United States will have elevated bad cholesterol levels. And that is what is represented here, with 25% of all the US adults having a cholesterol, LDL cholesterol, which is the bad cholesterol, being about 130 milligrams per deciliter. If we look at the map of the United States, we can see here a map of the United States, and where we see the dark brown, that is the areas that have a higher concentration of mortality from cardiovascular diseases. That is in the South. Unfortunately, the diet in those areas is not the best, and we see here states like California, Oregon, Washington, where people are very conscious about having a healthy lifestyle, where the mortality for cardiovascular diseases is going to be on the low side. When we talk about the heart, we're talking about the little arteries. We like to talk about the heart being a muscle that gets blood supply from little arteries, which what are called the coronary arteries. So the heart gets blood for the muscle of the heart from 3 coronary arteries. 1 goes to the right part of the heart and to the bottom. The main artery of the heart splits into 2, and 1 goes to the front of the heart, which is the most important artery, and 1 will go to the side of the heart. If we look at the coronary arteries are like little tubes that will provide the blood flow that is essential for the muscle of the heart to be able to function in the right manner. And over time, you can see on this graph on the right, you can see over time there will develop a plaque, which is obviously made out of cholesterol or fat, and that is eventually going to impinge on the blood flow to the muscle of the heart, and that is what is going to cause chest pain, angina, or eventually it may lead to a heart attack. So like I say, we have here a graphic presentation of one of the arteries of the heart. It has almost completely occluded or closed with plaque buildup over time, and we have a person's hugging the chest, representing chest pain, because the heart muscle is not getting enough blood, it's not getting enough oxygen for its daily requirements. Sorry about that. And nowadays we are lucky enough when we can fix those blockages that develop on the heart. In the past, we used to go with little tiny tubes or catheters from the groin axis, go all the way to the heart, where we were able to fix these blockages in the arteries of the heart, and in that way allow the normal passage of blood to the muscle of the heart. Nowadays, we try to go from the wrist, from the arm. That's a more simple procedure for the patient. It goes straight to the heart, and then we try to fix the blockages going from the arm of the patient. Once we are inside the arteries of the heart, where we can see this depiction, we see that there is a plaque buildup inside the artery of the heart that is closing the lumen of the artery. We go with little tubes, balloons, stents, which will actually scaffold the artery from the inside, allowing for the normal blood flow of the blood to the muscle of the heart, and in that way solve the problem that the patient had. Here you see on the palm of the hand, you see these little stents. Most people know what a stent is. These are very tiny tubes made out of metal. They resemble those springs that we see in pens. They are about the same size, as you can see, and we insert these little stents inside the arteries, and that is what is going to be scaffolding the artery from the inside. If can you see? I hope you can see this angiography. We can see this is a right coronary artery, and we have a catheter that's injecting dye inside the artery, and you can see that the dye stops in the middle of the artery, and that is what is causing a heart attack. And that's exactly what is a heart attack. There's a complete blockage of one of these arteries that provide blood to the muscle of the heart. And when it completely closes, that causes chest pain and eventually a heart attack that actually will cause irreversible damage to the muscle of the heart unless we go and open this blockage immediately. If you see in the middle picture, you can see there's a little balloon that is inflated in the mid portion of this artery where the blockage was. And if you look at this art now, you can see that the artery is completely open. You see the dye going all the way from the top to the bottom, and that is the blood flow that is going now normally to the bottom part of the heart, resolving the issue and probably saving this patient's life. And this is what we do in the cardiac catheterization. We open these blockages trying to prevent damage to the muscle of the heart. Like I said before, we go from the wrist. It's a very tiny tube that is inserted in the wrist, just like an IV infusion. And from there, we go and we perform all our procedures. And then the patient can sit comfortable watching TV or doing something else. And within 2-3 hours, patients are usually discharged home nowadays. So what we've been talking about the heart is we've been talking about the plumbing of the heart, the blood flow through the arteries of the heart to the muscle of the heart. And that is like the plumbing inside the house. But I think it's important to understand that there is also an electrical component to the heart. And this electrical component is very important because this is the electricity that is going to actually produce the necessary stimulant to the muscle of the heart to start squeezing like it should. So the muscle of the heart needs this electricity to be pulsating in a rhythmic fashion. Here we see a depiction of the heart with these little tubes in it, catheters, and we can see that we can measure and do a electrocardiogram. Electrocardiogram is all but a representation of the electrical current that is traveling inside the heart in order to stimulate the muscle and do the contraction of the heart. Sometimes the conduction of the electricity in the heart can go bad, and in those cases, patients may need some other type of devices. So if there's a blockage in the electricity, then the patient may need a pacemaker. If there is a problem with the rhythm of the heart, such as atrial fibrillation or extra systoles, beats, extra beats, or any type of arrhythmia, nowadays we can go inside the heart and we can actually cure the problem that is in the heart, and we can solve the problem of the arrhythmia and even atrial fibrillation. In the past, for atrial fibrillation, we didn't have a lot of things to do. Nowadays, we can go inside the heart and actually cure atrial fibrillation. This is a chest x-ray. We can see on the upper part of the chest, there's a little pacemaker. Pacemakers have become very, very tiny and very, very smart. I mean, they can provide a lot of information about what is happening inside the heart, about what is happening with the electricity that is circulating around the heart. And we get a lot of information from that. And although in the past we used to put these little pacemakers on the top of the chest, and they had these electrodes that would go all the way into the heart, nowadays we have very small pacemakers that go inside the heart and not into the chest, and they are inside the cavity of the heart, giving the electricity, and therefore preventing the need of having something in the chest or having those electrodes going inside the heart. And this stays inside the heart, and we can monitor this from the outside, very simple. Like I said before, patients with atrial fibrillation, we can now cure atrial fibrillation by going through the heart with little tiny catheters, and we can do what it's called an ablation, and that will actually cure atrial fibrillation. Talking a little bit about South Shore Hospital, this is one of the hospitals that we are affiliated, and I will be talking a little bit more about South Shore Hospital at the end of my talk. But I want to talk about something that is very important for us, and it's more about healthy heart living. Not long ago, we used to recommend 7 things to have a very healthy lifestyle. And you can see from this drawing, one is, of course, the diet, the weight, exercise, definitely not smoking, taking good care of the blood pressure, taking good care of the good cholesterol, the bad cholesterol, and diabetes. However, we have now one added essential component for this, and this is having a good sleep at night. We have come to realize that sleeping is very crucial for the heart. And unfortunately, people that don't get enough sleep or have obstructive sleep apnea or things like that will be at a higher risk of developing not only cardiovascular disease, but high blood pressure and other diseases. So talking about smoking, I think everybody's nowadays very much aware about smoking, that the damage it causes not only to the cardiovascular system, but also to the lungs. However, still, a lot of people in the United States are currently smoking. 1 in 7 adults in the United States is a smoker. 1 in 9 female adults in the United States is a smoker. And unfortunately, e-cigarettes have taken a big place, especially among the younger population, and especially at high schools. And we can see that map again from the United States, where we can see where is the higher incidence of smoking. And if you remember what we had in the past, where we had that very dark red area in the middle of the United States, where there was a higher incidence of cardiovascular disease, we can see also there is a very high incidence of smoking in this area. And therefore, they always go together, the pure lifestyle choices with the increased risk of having cardiovascular disease. And once again, we can see that states that are located in the western part of the United States, such as California, Oregon, and Washington, have a lower incidence of smoking. And lucky for us, also the state of New York has low incidence of smoking, which is very good for all of us. Talking a little bit about diet, this is a representation of the things that we should be eating, with a lot of fish, vegetables, and all that in the middle of the picture. Unfortunately, less than 10% of the United States adult population will eat the right things, and we all know about that we do not have the best of the diets in the United States. So one of the things that I always talk to my patients, there's a lot of options right now for diets. Patients always ask me about what type of diet to do. And there's a lot of options. Some of them are better than others. I like to recommend the Mediterranean style diet. I think this is one of the few diets that has gone through rigorous trials, actually, to try to see if it is beneficial for patients, and it has shown that it has a 30% reduction in the risk of stroke, heart attacks, or even death in patients that follow this diet. Therefore, I do this diet for myself, and I try to encourage my patients to follow the Mediterranean style diet. If we look at this pyramid of the Mediterranean style diet, we can see that physical activity is key for the diet at the bottom of the pyramid. And these are the type of foods that we should always try to encourage to have, such as vegetables, fruits, whole wheat grains, olive oil, very important, nuts and legumes, seeds, spurs, and herbs and spices. At least twice a week, we have to recommend to eat fish, and once a week, probably poultry, eggs, and cheese, and trying to avoid red meats and sweets, and having that at, at the most once every 3-4 weeks. I understand that meat is a very important component of the American diet, but we should try to avoid it and try to follow this Mediterranean diet in order to have a healthy lifestyle. A lot of questions revolve around alcohol and wine. And wine is actually recommended by the American College of Cardiology and the American Heart Association. They recommend 1 glass or 2 glasses at the most of red wine in the with meals. They think that it's healthy for the heart, no more than that. And obviously drinking a lot of plain water every day and avoiding sugary drinks. Diet is important. Having their correct weight is very, very hard. It is not easy to lose weight. It's very easy to gain weight. And unfortunately, a very high percentage of the American population, and not only American, a lot of the population in the world are struggling nowadays with weight. About 70% of people in the United States are either overweight or obese. That means that only probably 30% are at the right type of weight for their height and age. So that is a big issue. And what I tell my patients is to be careful with what they eat. The most important thing that determines weight is how many calories we ingest. It is calories in, calories out. It is very hard to burn calories. Even doing the most strenuous exercise, that is not going to burn a lot of calories, unfortunately. As much as I recommend exercising almost every day, that is not going to be the best way to lose calories, because we don't burn so many calories. The most important thing is going to be looking at how many calories we're ingesting, and that is going to limit our weight. So this is, again, the type of physical activity, the same map of the United States. Once again, we can see the type of activity that people do, and we can see that people in this area of the United States, once again, are not doing enough exercise. People in the West Coast, people in some other parts of the country are actually doing the right type of exercise. The recommendations from the American Heart Association, American College of Cardiology, at least 150 minutes every week of moderate physical activity, or at least 75 minutes of vigorous activity every week, or any combination of this. This is probably more than what most people would like to do, but this is our recommendation. And if you do moderate exercise, that is, probably trying to do at least 30 minutes every day, and that's going to get us to the goal. Also, just by doing some type of movement, standing, not sitting on the chair all day long, that will also be very important. And also just taking walks. We know that there's all the time these new studies that show us that maybe just walking could be just enough, just not be sedentary. So just walking Going outside in the evenings, what I tell my patients, if you can go in the evenings for a walk, 1 hour of a walk, as fast as you can, that is very good. I recommend not taking the dog for a walk because usually they like to stop, they're slow, whatever. I just say, go for a walk, just go for half an hour, 1 hour, as fast as you can in the evenings and have a walk. This is the right weather to do that. It's not as hot as it was a couple of weeks ago. Winter is going to be coming soon, and that also will limit our ability to walk outside. So this is the time where we can do that easily. Like I said before, sleeping has become one of the 8 things that we are trying to track to have a healthy heart. And we recommend between 7 to 9 hours of sleep every night. It is very important for the prevention of cardiovascular disease, hypertension, obesity, depression, and also for preventing dementia. We know that having a good night of sleep is going to have a lot of beneficial effects. And one of the things that we need to know is, you know, we have all these electronic devices now, not only TVs in our room, we have TVs, we have tablets, we have cell phones. The recommendation is turn it off, you know, turn it off and don't look at these things because that will keep you awake. Unfortunately, we know that the light from the cell phones, from the tablets, will wake up your brain and make it even harder to sleep. And you can set timers in these devices so you can actually go and have a good sleep. You can lock it, you can block it, try to do all those things so you can have a good night's sleep. If you have obstructive sleep apnea, that is something that needs to be taken care of. We know that it is associated with high blood pressure and with cardiovascular diseases. The recommendation is to do the sleep test, have a diagnosis, and if needed, treat it. Stress. I get a lot of questions about stress, and we know that stress is not so good for the cardiovascular system, especially not for the arteries, because it will lead to high blood pressure and plaque buildup. It is not easy to get rid of stress. Life in itself is very stressful, but there are some things that are important to do, such as exercising. We know that exercising will relieve stress, will relieve tension, anxiety, and depression. Having friends and family, having those social connections are crucial to reduce stress. I just talk about sleeping 7 to 9 hours every night. That will help relieving stress. Positive attitude, practicing relaxation techniques such as listening to music, and finding a stimulating hobby that can distract you will all help to reduce stress. So these are some of the things that I can suggest to do in order to relieve stress. Diabetes, very tough disease, unfortunately, very much related in some parts of the type 2 diabetes, what we call to diet and exercise. Unfortunately, the incidence of diabetes has been going up through the years. We have here a scale that goes from the year 2002 to the year 2016, and we can see that the incidence of diabetes in the Black population and also in the white population are going on the wrong direction, going up. And this is related, obviously, to the type of diet that we have in the United States and the lack of exercise. Once again, the map of the United States, the same areas, we can see that there's a higher incidence of diabetes in these areas, probably related to genetic factors, exercise, and diet. So talking about diet and diabetes, although we have very, very good medications that have come in the last couple of years that will help us treat diabetes, one of the most important things still it is diet and exercise. We have to try to control our sugar levels, and one of the things that we measure is, probably you've heard about it, is the hemoglobin A1C, and we want to have this hemoglobin A1C less than 7%. The hemoglobin A1C will give us an idea of how was the sugar control in the last 3 months. When we go and do a blood test and shows us that the sugar is elevated, that's a a shot during a time period. It's just like a little picture showing you what's happening in that moment. When we look at the hemoglobin A1C, we're looking at the last 3 months. How was that sugar in the last 3 months? Was it well controlled? Was it not that well controlled? Or do we need to do something else with medications? If it's below 6%, between 5.6 and 6%, that is what we call prediabetes. And between 6 and 7%, we don't give medications. If it's above 7%, that's when we start giving medications. High blood pressure, very well known that we call it the silent killer, because a lot of people may have high blood pressure and they don't even realize that they have it until it's too late. So it will cause a lot of damage into the cardiovascular system, and about half of the population in the United States, 47%, will have high blood pressure. This is something that probably you understand pretty well about the readings of high blood pressure. We have a systolic, the high number. We have a low number that is called the diastolic. The systolic is the pressure that is inside the arteries. The diastolic is the pressure in the arteries when the heart is resting. Both numbers are very important, both associated with cardiovascular disease. Right now, we are very stringent in our numbers. We know that the elevated blood pressure is anything between 120 and 130 systolic, and anything that is above 139 or 90, it's already called high blood pressure. So numbers have to be low. The things that we can all do to reduce blood pressure are, of course, eating healthy, trying to avoid salty foods, sugary foods, being more active, exercising on a daily basis, managing the weight, being at the right weight for the right height, definitely no smoking. Once again, sleeping between 7 and 9 hours a day are crucial to having low blood pressures, or at least managing high blood pressure levels if needed with medication also. Talking about having exercise and activities, 1 in 4 adults in the United States are actually up to the guidelines, doing the exercise they need for a healthy lifestyle, but the majority of adults in the United States are not doing that. Dr. Google, I get a lot of questions for patients that have surfed the internet, looking for answers, looking for things for that, changes or whatever is important, new medications. Sometimes they come to me with very, very good questions, very interesting things that, I am aware or I may not be aware. And sometimes I like to look at by myself. Google is a crucial part of our lives now. We can get very valuable information, but also at the same time, we can get a lot of bad information, unfortunately. It is always important, I think, if you see something in Google, to talk about it with your doctor and see what the doctor thinks about it. There's a lot of business in the internet through Google. So a lot of people are trying to sell you a lot of stuff, a lot of multivitamins, supplements, and things like that, that at the end of the day may not have any impact in cardiovascular disease, and it will have an impact on your pocket. Just talking a little bit about local statistics of cardiovascular disease in Long Island. About 8,600 Long Island residents will die from heart disease every year. More than 1,000 will have a stroke. And women are also affected in Long Island, just like in any place else in the world. This is a picture of our Mather Memorial Hospital. It is one of the safest and best hospitals in the area, has been nominated for multiple awards. And just trying to send a message that we are here for you if needed. Any questions?
Yes, thank you so much for the presentation, Dr. Gruberg. If anybody has any questions, you can enter them at the Q&A feature at the bottom of the screen. All your questions will remain anonymous to protect your privacy.
Jonathan, for some reason, I'm not seeing the full screen. Oh, there we go. Thank you. Now
Oh, of course. All right, we'll give it a few seconds to see if anybody has any questions.
okay.
All right, we have our first question here. Please define shortness of breath.
Oh, okay. Shortness of breath. That means that you are feeling difficulty in breathing, like, things that usually you should not be having difficulty breathing, such as climbing stairs or walking, and gets your breathing going fast or laborious. I think that's the definition of shortness of breath. It obviously depends for every person. It can be a little different. For a person that is very fit, can go climb 3-4 flights of stairs and don't get short of breath. For a person that is not in very good physical shape, just climbing 1 flight of stairs, at the end of the first flight, he or she may feel that there is some difficulty breathing. They need to stop because they need to catch up their breath. Unfortunately, some patients with heart failure may have shortness of breath just by lying flat, and they need to sit up because they cannot catch their breath.
Thank you. All right, next question. How would you treat pulmonary hypertension?
Okay. So the question is, what is causing the pulmonary hypertension? Pulmonary hypertension is a little removed from the topic that we had today. It's a very specific topic, and it is very complex, obviously. And the majority of the patients that I see with pulmonary hypertension are those patients that have heart disease that has led over time to an increase of the pressure inside the lungs. And therefore, the problem lies in the left part of the heart. And therefore, we try to alleviate the symptoms of pulmonary hypertension by fixing the left part of the heart. There are other diseases that can cause pulmonary hypertension, just problems in the lung per se, or problems in the arteries of the lung. Patients that have what we call primary pulmonary hypertension, patients that have diseases in the lungs, COPD, asthma, things like that, that over time can lead to pulmonary hypertension. Therefore, how you treat pulmonary hypertension depends on what is causing the pulmonary hypertension.
Next question. I don't quite understand this question, but I'll do my best here. If I take statin, do I need CoQ10?
CoQ10. So statins are one of the best medications that were ever developed. Their benefits are beyond anything we imagined in the past. We know that statins, by lowering the bad cholesterol, or what we call the LDL cholesterol, decreases the risk of having a cardiovascular event. That has been proven beyond any doubt. Unfortunately, a small percentage of patients, about 3 to 5%, according to the studies, will develop muscle pain when taking a statin. There have been some studies that have shown that ingestion of CoQ10 may alleviate those symptoms, but some other studies have been negative. At the present time, the guidelines of the ACC, the American College of Cardiology, American Heart Association, do not recommend having CoQ10 on a regular basis. Some of my patients take it. They swear that it helps them for the muscle pains when taking statins. All I can say is it seems that it's not harmful. I probably cannot say that it's going to help everybody.
All right. Next question. I was told by my cardiologist that I have an enlarged heart and also have a left bundled branch blockage. What advice can you give me for treatment? I'm a female who is 59 years old.
Okay, that's a very specific question. And definitely I cannot give you a very complete answer. Having an enlarged heart it needs to be assessed what caused it, right? We need to understand what is driving that enlarged heart. There are many diseases that can cause an enlarged heart. The most common, of course, is blockage in the arteries of the heart that eventually led to a heart attack or something like that, or other causes are cardiomyopathies. There is a process or disease in the muscle of the heart itself and not in the arteries of the heart. Therefore, the most important thing is to understand what is causing that enlarged heart, and we can treat it accordingly. Having a left bundle branch block means the way the electricity is moving around the heart. If you recall when I gave that portion about the electricity of the heart moves from the top of the heart to the bottom of the heart, trying to get all the muscle of the heart to contract at the same time in synchrony. So it goes from the top to the bottom of the heart, and it splits into right and left part of the heart. When you have a left bundle branch block, that means that the electricity that should be going to the left part of the heart is going around the heart. It's not going straight to the left part of the heart, and it's going around the heart. And what it represents is that the electrocardiogram is going to show that there's an abnormal wave of the electricity. And that's all it is. I tell the patients, a lot of people have it. It usually doesn't have anything bad, but it can be associated with diseases like the one you have. But on itself, we don't need to do anything with it. There's no need for pacemakers or anything like that.
Is it safe to take statins for many years?
Yes, absolutely. Very safe. Yes. Statins have been around for more than 35 years. They have been extensively studied. They're extremely safe. Like I said, a small proportion of patients will develop muscle pains, and in those patients, we will need to stop the medication. Some patients will develop a small increase in the enzymes of the liver. We know that it's not associated with any problems. Some patients will have a slight elevation in sugar, and also we know that it's worth it. The risks of the benefits of this medication are definitely higher than the risk of this medication. Very safe to take it for a prolonged period of time, and highly recommended to the people that need it.
All right, so that looked like it was the last question. I wanted to thank you again, Dr. Gruberg, for your presentation, and for everybody for joining us today. If you have any additional questions, you can email them off to matherhospital@northwell.edu. Once you exit the webinar, you will see a link to complete a brief survey. If you can please complete that survey, your feedback is extremely important to us in future programs. Thank you all again for joining today's webinar. If you'd like to view past HealthyU webinars, you can view them at www.matherhospital.org/HealthyU. Thank you all so much, and thank you, Dr. Gruberg, and have a great day.
Same to you. Thank you so much for attending this meeting.